Okay, section 3, part A. This is an intro to fitness. Now we get to start to do some of the more fun stuff with exercise prescription. This is from ACSM chapters 1 and 3. The Hayward text addresses this in multiple chapters. I didn't list all the chapters, uh, but for the most part, this is coming out of the Hayward text. The both texts are fairly similar though. Uh, so Exercise specialist, exercise physiologist's responsibility. It's our responsibility to educate clients. So we're trying to teach them how to exercise. We shouldn't just be like a tour guide or a caddy. Uh, I used to caddy for golf, so I use that example. It's not just about setting up the weights and leading somebody through something. We're supposed to educate and help people. Conduct health screening and testing, design exercise program, critique a client's exercise performance, try to make sure that the individual is completing activity correctly, and then motivate the client or the individual. So, physical fitness, we talked about this before. It's the ability to perform occupational, recreational, and daily activities without undue fatigue. And how do we determine this? So, physical activity and fitness terminology, I think most of you probably already know this and have experienced these things: cardiorespiratory endurance, aerobic fitness. Uh, the technical definition is the ability of the circulatory and respiratory system to supply oxygen during sustained physical activity. That's all nice and good. Uh, you also need to think of practical definitions that you could tell a client or an individual because saying that technical definition, most people are not going to understand it. So you want to use also some information that is practical. So how well can you run? How well can you maintain aerobic activity? Things like that. Body composition, the relative amounts of muscle, fat, bone, and other vital parts of the body. Typically, that's described as percent body fat. Muscular strength, the ability of the muscle to exert force. Typically, that is addressed as a one repetition maximal lift. In the lab, we also do a 2 to 5 rep lift, and then from there, we use a calculation to determine the maximal weight that an individual can lift. Muscular endurance, the ability of the muscle to continue to perform without fatigue. The terrible definition. Uh, the practical example is much better. Think about how many push-ups you can do. So as opposed to running, you have individuals that can run for a very long period of time, hours. Easily, they can run for hours. Uh, However, how long can you do push-ups for? A minute, 2 minutes? Uh, it's not very long. So the muscular endurance addresses how many reps you can do of a submaximal load, and really the thought, or you need to think of like a push-up test, uh, pull-ups, how many squats can you complete, a 225 bench. They'll do that in the football combines. uh, Things like that would represent muscular endurance. Flexibility, range of motion is the key term there, and this is the term that the text uses as well. Now, there's some other components that are listed which are good and useful. These have not gotten as much publicity in the past, but they do play important roles in exercise prescription. So, agility, the ability to change position of the body and space with speed and accuracy. So, definitely from a sport performance perspective, that's crucial. Coordination, the ability to use the senses such as sight and hearing together with body parts in performing tasks smoothly and accurately. I think the key there is smoothly and accurately. So you look at gymnastics, a lot of coordination going on there. Dance will have a lot of coordination. A golf swing will have a lot of coordination. Throwing a football correctly or a baseball correctly, softball, all of that will have a high degree of coordination to do it well. Balance, the ability to maintain equilibrium while stationary or moving. A lot of times we measure stationary balance, but when we look at sport, uh, dynamic balance or moving balance is going to be more important. Power, the ability or rate at which one can perform work. Another definition where nobody knows what the heck that is. But the power is going to relate to your burst capacity. So if you're looking at sprint performance, that would be power. You have the powerlifting Olympic lifts that you could do; those represent power. And when you're playing certain sports like football or wrestling, power is going to play a very important role. You want to be able to burst at certain appropriate time periods. So volleyball would be another one where you're jumping up, and that would be a burst power type of movement. Reaction time, the time elapsed between stimulation and beginning of the reaction to it. Reaction time is very important in sport. For one, how quickly can you move? That's important, but also reaction time is important in just what that term states, reaction. So if you're about to get hit and you can notice that and react to it, then you can brace yourself, which will decrease your risk for injury. Speed, the ability to perform a movement within a short period of time. So speed and power will go hand in hand with each other. It really just kind of depends on what you're doing. Are you trying to lift a weight? Then we're thinking more of power. If we're dribbling a ball, a soccer ball, a basketball, we think of speed in those instances. So it's just variations of a theme. Okay, so musculoskeletal fitness, the ability of the muscles in the skin. This is the same things as the previous slides. So it's just a way that the different textbooks address it. This is what I just discussed. I went through the ACSM book. The next sections, and I'll go through those rather quickly, address the Hayward text. So musculoskeletal fitness, they address it as muscular strength, muscular endurance, bone strength. When I ask a question on the test, I'll make sure that I use the appropriate terms so that it's not confusing. So look for things like muscular endurance rather than musculoskeletal fitness, because the musculoskeletal fitness will get a little bit confusing. So I'll try to make those adjustments so that the questions are kind of clear on the test. Body composition, here they mention percent body fat, relative amounts of fat versus absolute amounts. So relative would be a percentage, absolute would be a weight. Flexibility, the only thing that they add here is in addition to range of motion, they also mention some of the limitations to flexibility. Is it a bony structure of a joint, which is causing impingement or inability for the bones to move through the proper range of motion? Are you bone on bone? Is it size and strength of musculature and ligaments? This is what is typically a rate limiting factor in flexibility, or is it some issues with connective tissue? And there are certain instances where the connective tissue is more elastic. Ehlers-Danlos syndrome would be an example of that. Those people are hyperflexible, and that's not necessarily good either. Balance, core, neuromotor. This is what the ACSM text kind of used as skill-related fitness. I kind of lump these together. That may or may not be appropriate. But balance is very important. The core is important. So it's the balance is the ability to maintain a center of gravity that's more dynamic, maintaining a static position, performing voluntary movements, reacting to external disturbances. Could also be called core stability. There's technical nuance differences between these terms, but they are to a certain extent used together as well. I will address here, and I know I address it in the specific sections later on in the course, but with core stability, I state core stability as anything, all the muscles that support a joint structure. So all the muscles that support the shoulder would be an aspect of core stability. The muscles that support the hips would be core stability. Low back, abdominal muscles, and then there's a term, anti-rotational core. So this keeps the spine uh, in a neutral position while the body is kind of twisting around it. So we'll talk about those in more detail in the upcoming sections. But core stability and thinking of the structures that support the muscles that support joint structures is going to be very important. Now I put this in there. A glaring omission. I feel that a glaring omission is movement progressions in exercise. You see this in Olympic lifting. They have movement progressions so that people don't lift a weight that's potentially dangerous. For high school sports, people should definitely engage in movement progressions. They should learn how to lift a weight properly. And hopefully, those of you that have completed Olympic lifts and participated in high school weightlifting for sports, for sports conditioning, you completed some sort of movement progression. Unfortunately, sometimes you see, especially at fitness centers, where somebody just tries a lift and has no idea how to do it, has never done it before. That's risky. They greatly increase the risk of injury associated with that. So we have movement progressions for the for Olympic lifts, and we have movement progressions for physical therapy. However, for everything in between, we don't really have movement progression. So when you go to a fitness center and you see somebody completing a squat and they're completing a quarter squat or their squat just looks god awful, there's no real instruction for how to remediate it and make it better, or at least not out there for the general public. If you have an exercise science degree, hopefully you've been taught it and you can make the appropriate adjustments and give the individual the proper instruction. However, if you're just looking for it online or you're looking at how to complete a squat, they don't necessarily discuss the movement progression. If you look in the research literature, I recently did a search on PubMed for movement or exercise progression. And again, I saw things for physical therapy and I saw things for elite athletes, but I'm not seeing anything for the general public. The general public can really use good movement progression information. So, you know, and part of that is how do we progress and how do we regress? So if somebody is doing it properly, how can we make it more difficult, more challenging? If that's what they're interested in, and if they're not doing it correctly, then how do we adjust it, make it easier, and teach them the various pieces so that they can complete the movement correctly. So those are the basics of of fitness.